with the ADA in San Diego, new insights into the LEADER trial presented. What did you learn about the possible mechanisms of the cardiovascular benefits?
Right, so it's clear that LEADER was a cardiovascular safety trial and demonstrated a very significant reduction in cardiovascular events, MACE, and cardiovascular death. And big trials don't necessarily explain mechanisms. It's hard to find mechanisms from big trials. Big trials tell you it's a clinically relevant outcome. So, you know, if you use liraglutide, you will get this benefit. Now, it turns out, despite a lower A1C with liraglutide, what's remarkable is that the rates of hypoglycemia are less. Mm-hmm. So you would think with the lower A1C you'd have increased risk of hypoglycemia, but you don't. And there also is a marked reduction in severe hypoglycemia. And so the purpose of the presentation was to see if there is an association with severe hypoglycemia and cardiovascular events. Mm-hmm. And so we took the entire population, not just the group on liraglutide, the whole population, and clearly there is an association. So if you have severe hypoglycemia, you're likely, more likely to get a cardiovascular event. But when we analyze patients with severe hypoglycemia and without severe hypoglycemia, the benefits of liraglutide were there for both groups. Okay. So we don't really know if hypoglycemia is mediating it or just identifies a population that is very susceptible to cardiovascular events.
Is the same true for different medications patients were getting? Did that have any influence on the benefit?
That's, we have to analyze that more carefully. So patients who were on placebo injections and not liraglutide got more insulin. They also got more sulfonylurea. So it may be in part related to the fact that they had to get other diabetes medications. Mm-hmm. So we just don't know, but we're going to look into that as well.
Okay. The CV benefit seems not to be a class effect in the GLP-1 receptor agonists. What about the SGLT2 inhibitors?
Okay, so SGLT2 inhibitors are an interesting class of drugs. They work by a totally different mechanism. They're not. You don't have to have a particular type of diabetes. You could be on insulin, off insulin, on oral agents. The key thing is that you have to have good kidney function so that you can get glucosuria and a natriuresis. And now the interesting thing today is we just heard the results from Canvas. So EMPA-REG outcome was the first study of a diabetes therapy to show a reduction in cardiovascular events. Not just safety, but a reduction in cardiovascular events. 38% reduction in cardiovascular death. And Canvas was sort of mixed. It showed some benefits, but there were some undesirable effects that we didn't know about, namely amputation. We didn't see that with EMPA-REG outcomes.
Okay. So, did you have time to, or do you know about those amputations and the fractures in EMPA-REG?
So in EMPA-REG, there are no increased fractures and there's no amputation, increased risk of amputations, from what we can tell.
Okay. Thank you.
All right.